Hi everyone, it's Lacey from Fayetteville Pelvic Health. I'm here with my pelvis. I've named her Monica. I wanted to remind you guys that the tailbone can be impacted by pelvic floor. I still get patients who have had chronic tailbone pain, even acute tailbone pain, which means new tailbone pain. But they've been told for years that it probably has nothing to do with their pelvic floor, and they've had a hard time finding relief from it. If you look, so here's our tailbone. This is called the coccyx. It attaches to our sacrum, okay, which is this big kind of triangular bone here, and that attaches to our lumbar spine and our hip bones, okay? So here's our tailbone. Here are muscles and ligaments of the pelvic floor directly attaching to the coccyx. So if you have tailbone pain and no one has assessed your pelvic floor, then there's probably a piece of the puzzle that is missing, especially if you haven't gotten any better. Pelvic floor therapists are trained to get to these muscles directly and assess them. That doesn't mean that your primary physical therapist can't assess them. They also have techniques to palpate these muscles externally, so kind of through your other layers of fat and tissue and muscle, sometimes through your clothes. However, if they maybe aren't familiar with that, or they're not comfortable with that, or they have any suspicion that yes, something is going on in these muscles and they're just not, it's kind of out of their wheelhouse to go there, then have them send you to a pelvic PT, because that's really the only difference is that we have some access to these pelvic floor muscles that is a little bit more direct. So these muscles, if there is tension, if there are trigger points in these muscles, that can definitely impact the tailbone and kind of the surrounding tissues. So it may just be that you are kind of sensitized because there's some things going on, and we can work to reduce that sensitivity over time. There's a lot more that goes into it. We look at posture, we look at all of the other muscles kind of everywhere else, how you move. There's a lot that goes into it, but there's a direct relationship between the pelvic floor muscles and the tailbone. Look how close our anus is to our tailbone. Look at these connections. Look at all these muscles that are right there. It's all connected, y'all. So I just wanted to point that out because I've had several patients who've come in and they've had years of tailbone pain and nobody's really been able to pinpoint it. And they hadn't really seen a physical therapist for it yet because a lot of their providers assumed that we don't treat that, but we do. All physical therapists can treat tailbone pain. Sometimes they will send you to a pelvic specialist just to get better access to those muscles. But the answer to many people's questions, can physical therapy actually do something for my tailbone, is yes. Okay? So most of the time. I mean, it depends. But I mean, yeah, it's worth trying. Okay, so I hope that you found this helpful. Share it if you know anybody that has struggled with this, and certainly message me any questions that you might have. Thank you guys for watching, and have a great day.